Pursuant of the Standing Orders 23.22, I table report on the inquiry into workplace drug testing in Victoria, including appendix extract of proceeding and a minority report from the Legal and Social Issue Committee, and I present the transcript of evidence. I move that the transcript of evidence be tabled and the report be published.
The question is the transcript of evidence be tabled and the report be published. All the opinions say aye. Aye. Against no. The ayes have it. Mr. Liu, take note.
I move the Council take note of the report. Mr. President, since the introduction of the Narcotic Drug Amendment Bill 2016, which amend the Narcotic Drug Act 1967, Victorian medical practitioners have been able to prescribe medicinal cannabis to their patients. In the preceding years, we have experienced a rapid increase in the use of medicinal cannabis. This has posed a new challenge in relation to the workplace drug testing policies. In Victoria, workplace drug testing is neither mandatory nor prohibited. However, accompanying the regulation specified that the mining industry must have alcohol and other drugs policy that explains when testing is required. Policies also require the specific legislation governing several other sectors considered to require high safety standard. The committee heard that current legislative and regulatory framework about workplace safety and testing practice may discriminate against employees who have been legally prescribed medicinal cannabis. While the committee fully understands the concern raised by employees and advocates, it has to balance this with the employer's legal responsibility to keep workplace safe. The challenge comes down to how to test for impairment rather than the mere presence of drugs. Based on the evidence the committee collected, it appears clear that the more work needed to be done to find alternative methods to test for impairment that provide a fairer picture of the employee's ability or lack thereof to perform their tasks safely. The committee is aware that the work in this area is constantly evolving with the aim of developing an accepted way of testing impairment. Until then, the committee believes that the current legislative and regulatory framework should be updated and provide more specific guidelines to employers on the use of prescribed medicinal cannabis and drug testing in the workplace. The committee has made recommendations to this effect. On behalf of the committee, I would like to thank everyone who made a submission to these inquiries and spoke to us at the public hearing. The committee relies on your evidence, some of are very personal, and your expertise to understand these complex and evolving topics to the use of medicinal cannabis and its consequences in the workplace. I would also like to thank my fellow committee members for their hard work and cooperation throughout these inquiries. Finally, I would like to pleased to say thank you to the Secretaries, Sally Trigard, Julie Barnes, Tiara Lazari, Caitlin Connolly and Patrick Ryan for their support and ongoing assistance through the inquiry. Mr. President, I commend this report to the House.
You have a contribution, Committee Member, Ms. Payne.
Thank you, President. I rise to make a contribution to the tabling of the workplace drug testing report. I want to thank my colleagues first and foremost who were part of the committee, including Chair Trung Liu, and of course the Secretariat for their unwavering commitment to hard work on the hearings and on this report. The tabled report is a reasoned and well-balanced set of research, findings and recommendations that paint the picture of the current processes, practices and impacts of workplace drug testing. It was this week, a year ago, that Legalise Cannabis Victoria's motion to set up an inquiry into workplace drug testing practices in Victoria passed the Legislative Council. And here we are a year on, tabling a report that tells us exactly what we knew and what we were hearing from a lot of our people. Workplace drug testing practices in Victoria are discriminatory, disorganised, outdated and lack proper safeguards for employees. Victoria can do better, so I urge the government to action all of these recommendations in the report. This report makes several important recommendations, but I'd like to focus on one in particular. Recommendation 3 in Chapter 4 recommends that the government move to amend the Equal Opportunity Act to ensure people living with a disability who are taking a prescribed medication are protected from discrimination. This is an important reform, particularly for patients experiencing ongoing stigma in the workplace for simply taking their medicinal cannabis as prescribed. During my time as a member of this Parliament, I have heard countless stories of people who have lost their jobs simply for trying to do the right thing and disclose that they are a medicinal cannabis patient. The findings of this report are well overdue and I welcome them. Thank you.
Mr Batchelor.
Some brief remarks as a member of the Legal and Social Issues Committee in relation to this report. Just wanted to extend my thanks to Mr Liu for chairing the inquiry, for all the members of the committee. I think it was a very constructive process. I think we all worked very well together on some challenging topics in a short period of time. Particularly want to thank the committee secretariat, the Legislative Council committee staff are doing a power of work at the moment under an enormous workload. And I wanted to extend my thanks for their work on this report. It was very thoughtful, very well done. I think the issues that it raised do need to be considered carefully. I think we heard some very compelling evidence, particularly from some very passionate members of the union movement. Particularly want to thank the members of the Australian Manufacturing Workers Union, the Health and Community Services Union, the Mining and Energy Union, for their evidence. There does need to be proper frameworks to deal with the issue of workplace drug testing. It does need to be matters that are properly dealt with in formal workplace relations settings through proper agreements. There needs to be detailed policy work and updated by WorkSafe. This is a very important issue and I encourage members who are interested in it to read the committee's report.
Mr Eshank.
Thank you, President. I rise to join Ms Payne in welcoming the tabling of this important report into the inquiry of workplace drug testing. The inquiry found that while a few sectors have mandated regulations in place for workplace drug testing, most industries in Victoria operate in a relative vacuum. WorkSafe guidance on this was last updated 17 years ago, almost a decade before medicinal cannabis was legalised in Victoria. The inquiry heard that the lack of up-to-date regulations resulted in discrimination and dysfunction and terrible outcomes for workers. Happily, this issue is addressed in the committee's first recommendation that drug testing should only occur where employers have a well-founded belief that an employee may be impaired at work and should only then occur in the context of a comprehensive alcohol and other drug policy and accompanying support framework as agreed between employers and employees. In other words, drug testing should not be imposed randomly at work. When required, it must be done respectfully and with appropriate supports in place. Further recommendations aimed at modernising existing regulations include amending the Alcohol Health and Safety Act to define key principles around AOD testing, requesting that WorkSafe convene a multidisciplinary working party to develop a compliance code to address matters like rights and obligations of employers and employees, education, model policies and practices, and how to access support, a broad-based public education campaign, and a recommendation that WorkSafe investigate impairment testing technologies for their suitability in workplace settings. Legalise Cannabis Victoria commends the report and urges the government to expeditiously give life to its recommendations. Finally, we express our heartfelt thanks to all of those who contributed to the inquiry and to our wonderful Secretariat who so ably supported all concerned.
Dr Mansfield.
Thank you, President, and I too would like to thank Mr Liu, my fellow committee members, all of those who participated and gave evidence, and particularly the committee secretariat for their hard work on this inquiry. It was an incredibly interesting and, I think, as has been said, constructive inquiry. While it may have been triggered, I think, in part by the increased use of medicinal cannabis and the complexities that this has raised when it comes to workplace drug testing, what this inquiry actually brought to light is a much broader issue with the inconsistent and outdated workplace drug testing practices, the lack of appropriate guidance for workplaces, and it really, I think, called on us to completely rethink workplace drug testing as a whole practice. Workplace drug testing simply checks for the presence of certain substances, and apart from alcohol, the presence of most other substances does not reasonably correlate with impairment. And that's something that came through very strongly in this inquiry. And moreover, testing actually, it doesn't test for every potentially impairing substance and doesn't screen for many things that cause impairment and equally, if not more, impact workplace safety. So workplace safety for workers and members of the public that they may serve is paramount, and we should therefore be looking holistically at impairment arising from any cause, be it prescription, over-the-counter medication, illicit substances or sleep deprivation as examples. Workplace drug testing, in my view, has an extremely limited application, if any, but accepting that it will be used, it must be used within a framework that respects people's rights to dignity and privacy and focuses on supporting rather than punishing workers. And I think that is something that comes through very strongly in the recommendations of this report, and I commend it to the House.